Gathering together top research scientists, government, and healthcare leaders, Gallup's 2008 Global Well-Being Forum is exploring the key issues that affect the well-being and financial health of nations, communities, and organizations.
One of the things we're seeing right now is there's a downturn in the economy, of course, but people don't feel the downturn quite as much if they have a good workplace. They have a workplace where they can actually contribute and be a part of some significant things. That then affects how the business performs. So whether they hold their own during a down economy, if a business holds their own, they got to have their people behind them. If they don't have their people behind them, we're seeing that those business units tend to drop significantly in terms of profitability and other business outcomes that we look at.
Healthcare is an important aspect of this discussion. Currently, 47 million people in the United States are without health insurance. On top of that, healthcare is one of the biggest financial sectors of our economy. Former House Speaker Newt Gingrich and CDC's Dr. Julie Gerberding offer insight into improving the healthcare system in the midst of the global financial crisis.
We need to have every single American in an insurance system. The insurance system has to have a provision for wellness, for early testing, for teaching people if they have a chronic condition, and we will get dramatically better outcomes, and we'll actually save money if we have everybody in that kind of system.
What we really need to do is to understand where health happens. Generally, it doesn't happen in the hospital. It happens in school, at home, in the community, in the workplace. Basically the places where people build their social networks and make decisions about their lifestyle behaviors.
The relationship between social networks and health is the main focus of Dr. Nicholas Christakis' work, an internist and social scientist at Harvard University.
So intervening on one individual can have this ripple effect and affect many other individuals. And the reason that's important, in my opinion, from a public policy point of view, is that social networks can act as a kind of multiplier. So if you make an improvement in one person's health for X dollars, you get much more improvement in the population for your X dollars than you previously thought.
The degree to which these social networks can affect a broader society is still unknown. But at the core of this phenomena is measuring the health and well-being of citizens around the globe, the goal of the Gallup Healthways Index, giving a daily measure of people's well-being. I'm Yasmin Vasugan. Join us again to hear more voices from around the world.